Leaders at the Northern Kentucky Health Department, along with our Department for Public Health, indicate that the number of HIV cases now linked to intravenous drug use is apparently 4 times higher than normal.
Specifically, we have a cluster of cases identified in Campbell and Kenton counties. This change is concerning, although not surprising, given the ongoing issues that we have with injection drug use in our region.
Campbell County and Kenton County have experienced the greatest increases of HIV diagnoses in injection drug use, with 8 cases and 10 cases respectively in 2017. In the past 9 years, Campbell County never had more than 1 case per year with injection drug use as a risk factor, and Kenton County has never had more than 2 cases diagnosed per year with injection drug use. Our local and state HIV staff have attempted to link each of these cases to care as soon as they were reported in 2017. We have devoted resources, including an additional epidemiologist and several disease intervention specialists from around the state, to be available for this investigation. We've been in regular contact with Dr. Sadler and her team, as well as the infectious disease specialist from CDC.
HIV testing rates are typically low among individuals who inject drugs. Data from the CDC shows that only 42% of people who inject drugs are getting tested for HIV at least once per year. We've already begun efforts to do targeted HIV testing among individuals who are currently using drugs, and those efforts will continue to be ramped up even more.
Protecting the community's health is our top priority and will remain so. The Kentucky Department of Public Health and the Cabinet for Health and Family Services stands ready to assist Northern Kentucky and to provide all of the resources at our disposal to help investigate and address this issue. We do not want to give the impression, however, that the community at large is at risk, but we also want the public to know that the health of the overall citizenry is related to the health of each individual citizen, and that awareness is a key component.
In Kentucky, the state of Kentucky, 70% of the people addicted to opiates are on health insurance. So employers in this region and regions across the state of Kentucky are bearing the cost of this issue. So to me, we need to combat that so that we can affect a very positive impact on the cost of doing business in the state of Kentucky. So I do think it has a huge economic impact, much broader than just the few numbers that were expressed here earlier, that will help go a long way in making Kentucky a better place to live, work, and do business.